thorax, 12 ribs. Last two ribs are floating, so they are, what it means, they are connected to the vertebrae of the spine, and they float. They are shorter, they're like short, and they just. So if you find first the pelvis, ilium, and then you move into this hollow. There's a hollow, and then finally you will come across the 12th rib. Yeah, and that is kind of like the 12th floating rib, and it's short.
Oh, is that low?
Yeah, it's about here. Here. And then just above is 11th, obviously, but it's like double length. And so this is your landmark on the side. And then of course all this is ribcage, into the xiphoid. So, and then around that area, it's a dome shaped like dome shaped, and where you have major breath muscle, which is diaphragm. I'm losing my words. That one, yeah. And so it fills up whole this area, and it's a major muscle that separates the lungs, the heart from the abdominal region. So it's kind of like a ceiling for all the abdominal region. Now, interesting part about the diaphragm, if you look into the diaphragm, and the pericardium sits on the top of diaphragm with the ligament, so it's not separated. So directly by diaphragmatic breathing, you are involving the movement of the pericardium and massaging your heart, because it moves.
What is the pericardium?
It's a sac that heart is protected in.
And it's connected to the diaphragm.
And it sits directly on the top of the diaphragm with this very strong ligament. So movement of your diaphragm creates the opening in your heart. So very often people with the shallow breathing, they have a lower blood circulation. They might also have like pains in their hearts. So there's not enough engagement in the heart also with the shallow breathing. And shallow breathing is the breathing that just moves to the top, doesn't involve the deep diaphragmatic belly breath, which also creates that opening in the heart, where pericardium and the heart can really have a space. And so we're going to work a little bit on this area. And this area is very elastic, like you can really bring the movement into it. Into the session, sometimes when you want to engage the diaphragm, what you can do, you can just like softly move the rib cage. And that's also start massaging all the internal organs.
Are the ribs connected to the spine bones by ligaments, or is it how do they
ribs? Every rib has a joint that connects to the spine, to the vertebrae.
It's a joint. It can move.
And then there's joints in front that connect it to the sternum. Yeah, it's a joint that is movable. Each joint is when two bones meet, it's called joint. Yeah, so it's movable. So we have like each finger has like many joints. Like we have hundreds of joints in the body. It's not just elbow joint and wrist joint. Yeah.
360, I think. I forgot.
I don't know, like one foot has 26 bones. And that's, I think that's 25% of all bones in the body are in both feet. Imagine, yeah. And that is, I think, like 40 something joints just in one foot. So just we're gonna mobilize a little bit of rib cage this way. Is that okay?
Feels nice.
And of course, like you might be working with people who has osteoporosis, that are a bit older, the bones can be a little bit more fragile. You don't want to press this much, you know, he's a young stud, you know, healthy guy, so you can just give it a go. But be careful also with it, yeah? Just gentle, listen, see how they feel about it. In a way, it is fragile area, but it's very mobile. It has to be mobile because to create a space for breath.
It feels really good.
So we're gonna do that, and then we will maybe make connection with the belly. Yeah, so just taking a few deep breaths into my hands. It's all watery. Yeah? The quality is water here. And for some people it will be difficult to relax, so they might still have this like really holding. So then you want to bring more gentle movements, and like this is enough. Right, and then with diaphragm you can work in many different ways. You can work like diagonally, so if I'm on this side, I might go with my fingers under. It's quite loose here, so it's easy.
Does that mean that the diaphragm is loose or the muscles that are there?
Both. For you, it's belly is loose, diaphragm is loose.
So you keep the fingers and he keeps on breathing, or you go with a little bit with the flow?
When you work on diaphragm, you invite breather to go more shallow to this part. Because if they breathe diaphragmatically at this point, they will push you out and you want to go in. So just for a moment, breathe into the top of your lungs and relax in the belly. And then you work around, and you can work up and down. All this area you can go under.
It's even painful if I breathe with the belly.
Yeah, it could be painful. Or you can go also with the thumbs, like this. The other way, you are on the same side, and you one hand you just push in, and one hand you sink in, and then you push it in a little bit like this. Is that okay?
Mm-hmm. And your fingers are pressing down towards the spleen, or you're more like
in.
Is the diaphragm a series of muscles?
No, it's one big dome-like shaped muscle. One. Actually, it's not. I mean, it's like it's connected to the psoas, iliacus. But like, if you kind of separate it anatomically, it would be one muscle. If you cut it off from all other core segments, it would be dome-like fascia. So that's another way, and always like communicate. Be gentle, be soft in this area. You can, and the more down you go towards floating rib, the more sensitive it is. So you can just go all the way. If you have a nails, then try to cut it off, or then work with the knuckle. Yeah, knuckle is also possible. So you don't cut the skin. Or thumbs like this. Is that okay?
Yeah.
So that's the area we work with. The other way that you can do, which is a little bit more intimate, you go just under and you just ask for. Is it okay if I go behind your legs? And then you just go under. And then it's nice because you have just like full access. So now I'm just embracing full muscle. Always communicate that it's not too much. What? Can you touch psoas muscle? It's more for pelvis. And I kind of stopped teaching this because it's very complicated. So if you know how to do it, you can, but it's more for pelvis. And then, what I've done yesterday with Vincent, I was working, he said that he has here in the solar plex, he had this knot or whatever he felt. So what I've done, I was just slowly sinking into this place. So you measure, it's about it's between xiphoid and belly button, and you measure halfway through these 2 points, and that's about solar plexus.
It's what I learned is it's 3 fingers down and then right there.
Yeah, so
So you do the
you can measure in many different ways.
This is solar plexus.
Yeah. And then I sink in, and I'm allowing the tissue to open. I don't push with it, I just sink in.
Are you breathing?
Yeah, it's good. And then what I ask him to do, I stay with the resistance, and then you bend your knees and you lift, and you just release on my fingers. I stay steady and you adjust. And you can move a little bit like in belly dancing, just bringing all this opening. Engaging the movement. Just be really mindful with that. If there's any too much pulsing, watch the face, watch the body language. If the person starts rolling their eyes or something off, then stop it. Yeah. How is that feeling?
Good.
Good.
Yeah, it's nice to be able to regulate the
Yeah.
force. It's yourself.
Exactly, because then they go as far as they want. And he goes.
You're almost touching his spine.
No, it is still,
Grab it.
yeah, it's still about 10 centimeters to the spine.
Can you do that with the elbow?
You could do with elbow in extreme cases, but
For a man?
But this is more than enough, huh?
yeah, it's just more than enough.
Oh, yeah.
Yeah. Again, if you have nails, you could possibly use also knuckles. Yeah. Soft knuckles. It's not like a fisting box. It's kind of relaxed hand and sink in with the knuckles. It's okay.
Uh-huh.
Now I'm quite deep.
Yeah, it feels. But it's nice.
So that's optional. Then you don't have to do it. It's optional. Just if that is necessary as a person. Yeah.
it's kind of hard to dig through that.
When there's a lot of belly fat, you have to spend more time to come through the fat and wait more, a little bit more time. It takes a little bit more time. Yeah. But it's doable. All right. I think